Bonjour et merci de vous être joints à nous aujourd'hui. Aujourd'hui, Statistique Canada a publié ses plus récents chiffres de l'emploi. Ces chiffres représentent plus d'1 million de Canadiens et plus d'1 million de familles qui ont peur et qui reconnaissent beaucoup de difficultés. À vous tous, laissez-moi vous dire que nous sommes ici pour vous. Si vous n'avez pas déjà appliqué à la prestation canadienne d'urgence, faites-le, s'il vous plaît. Elle est là pour vous aider. J'aimerais aussi inciter tous les employeurs canadiens, s'ils le peuvent, de suivre l'exemple des compagnies qui ont vu ce que nous avons annoncé concernant la subvention salariale et qui ont décidé d'embaucher à nouveau les personnes qu'elles ont dû mettre à pied. La subvention salariale sera rétroactive. Nous travaillons fort pour la faire adopter par le Parlement. Si vous pouvez, s'il vous plaît, utiliser la subvention salariale afin d'assurer que le plus de Canadiens possible puissent conserver leurs emplois. Nous savons que de nombreux Canadiens reconnaîtront beaucoup de difficultés à cause de COVID-19. Certains ne sont pas couverts par la subvention salariale ou la PCU. Nous travaillons très fort à trouver des moyens pour vous aider. Today, Statistics Canada released its latest employment numbers. These figures represent more than 1 million Canadians and more than 1 million Canadian families who are experiencing great hardship and who are really afraid. To all of you, let me say, we're here for you. If you haven't already applied for the CERB, please do so. It is there for you. I would also like to urge all Canadian employers, if they can, to follow the example of those companies that have reviewed the wage subsidy commitment and have decided to hire back many people they had laid off. The wage subsidy will be retroactive. We are working very hard to get it through Parliament. If you can, please use the wage subsidy to be sure that as many Canadians as possible can keep their jobs. We also know that there are many Canadians in real trouble right now because of COVID-19. Some are not covered by the wage subsidy or by CERB. We are working hard to find ways to support you too. Okay, so today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, and Canada's Deputy Chief Public Health Officer, le Dr. Njoo. Et après ça, le président du Conseil du Trésor, Jean-Yves Duclos. And of course, our Minister of Health, Patty Hajdu, is here to answer your questions too. Dr. Tam, please.
Hello, everyone. So I'll start, as usual, with an update on the numbers of COVID-19 cases in Canada. There are now 19,774 cases, including 461 deaths. Again, these numbers I know are changing as we speak, as provinces provide their updates. In terms of lab testing, we've now completed tests for over 373,000 people, with now over 5% confirmed positive, as Canada continues to improve testing to track where the disease is spreading. Of course, when I wrote the speech last night, I started the next paragraph with the weather warming. So anyone who's looked outside the window in Ottawa or looked at the weather forecast, that is not the case right now. But the holidays are almost upon us. And I want to reiterate how important it is for us to maintain our resolve to plank the curve. So far, the efforts of all Canadians are making a difference, from healthcare providers saving lives on the front lines to public health and lab professionals testing and tracing COVID-19 spread, to essential service workers keeping our hospitals and our homes stocked, and every Canadian who is staying at home. I recognize that these changes in our daily lives that we are asking people to make are extremely difficult. Despite the hardships, we are all in this together. Canadians' collective effort to slow the spread has allowed our health system to cope, and that means we're protecting health services for everyone. So, during important religious observances, including Passover, Easter, Vaisakhi, and Ramadan, we need to not let down our guard. That means dinners and celebrations need to be strictly limited to your existing household members only. And as I've said, the safest plan for your holidays is a staycation for the nation. Make arrangements now for virtually connecting with others over phone, email, and video chat. We need to protect each other, and that is best done by keeping physically apart but virtually together. Connecting has never been so important, so please support each other. Thank you.
Et maintenant, je donne la parole au Dr. Njoo. Dr. Njoo, s'il vous plaît.
Oui, merci, bonjour. Tout d'abord, le point sur les cas de COVID-19 au Canada. On dénombre maintenant 19 774 cas de COVID-19 au pays, dont 461 décès. En ce qui concerne les tests en laboratoire, nous avons testé plus de 373 000 personnes, dont plus de 5% ont été déclarés positifs au virus. Le Canada continue d'accélérer le rythme des tests pour traquer où se propage la maladie. Tandis que la température se réchauffe, même s'il neige actuellement ici à Ottawa, et que les fêtes du printemps approchent, on tient à rappeler à tous l'importance d'aplatir la courbe. Jusqu'à présent, les efforts des Canadiens fonctionnent. Les employés du secteur de la santé qui sont sur la ligne de front pour sauver des vies, des professionnels de la santé publique et du laboratoire qui traquent le virus, les travailleurs essentiels grâce auxquels nos hôpitaux et nos maisons ne manquent de rien, et tous les Canadiens qui restent chez eux malgré les difficultés doivent continuer de se serrer les coudes et faire face à la pandémie ensemble. Grâce aux efforts collectifs de toute la population canadienne pour freiner la propagation de la COVID-19, notre système de santé tient bon. Nos efforts protègent les services de santé pour le bien de tous. C'est pourquoi, même pendant les fêtes de Pessah, de Pâques, de Vaisakhi et de Ramadan, il ne faut pas baisser la garde. Cette année, nous devrons célébrer ces grandes fêtes uniquement avec les membres de notre foyer. Pendant ces quelques jours de congé, nous devons tous nous protéger en restant à la maison et garder le contact par téléphone, par courriel et par vidéo. Le meilleur moyen de nous protéger les uns les autres est de nous tenir éloignés les uns des autres. C'est pourquoi il n'a jamais été aussi important de maintenir le contact avec notre entourage et d'être solidaires. Merci.
Merci, Dr. Njoo. Maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
Merci, Chrystia. Hello, everyone, et bonjour tout le monde. Bien, ce matin, le premier ministre Trudeau a donné un message d'espoir et de courage, et un de ces messages faisait référence au 102e anniversaire du début de la bataille de Vimy en 1918. C'est un message qui résonne particulièrement pour les gens au Québec et dans la région de Québec, puisque le Royal 22e Régiment, qui est une institution au Québec et à Québec, a contribué significativement à cet effort de guerre. Et donc, on se souvient de leur engagement, de leur courage et du sacrifice qu'ils ont fait pour notre pays. Et je pense que ça nous inspire et ça nous guide dans les circonstances que nous vivons aujourd'hui. La deuxième chose que j'aimerais faire, c'est faire une mise à jour rapide de l'état de la situation en ce qui a trait aux demandes de prestations canadiennes d'urgence. Hier, un total de 750 000 demandes ont été faites pour la prestation canadienne d'urgence, ce qui monte à 5 millions en tout de demandes de prestations canadiennes d'urgence depuis le 15 mars. De ce 5 millions, 4,6 millions ont déjà été traités, ce qui est une excellente nouvelle pour les millions de Canadiens qui se retrouvent dans des conditions difficiles aujourd'hui, dans l'anxiété et dans l'insécurité. Et en terminant, pour les Canadiens qui sont nés en octobre, novembre et décembre, et c'est aujourd'hui qu'il faut déposer votre demande de prestations canadiennes d'urgence sur le site coronavirus, donc le site canada.ca/PCU-coronavirus. Merci, Chrystia.
Merci, Jean-Yves, et on est prêt à répondre à vos questions.
Bonjour. Alors, comme d'habitude, on va commencer par 3 questions au téléphone. 1 question, 1 follow-up, starting with the phone. Operator.
Thank you. Merci. We will now take questions from the telephone lines. Nous prendrons maintenant les questions de ligne téléphonique. Our first question, notre première question, is from Lena Dibb avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour. Ma question est pour vous, Madame Freeland. On comprend maintenant que ça va durer des mois avant un retour à la normale. Cette subvention salariale, elle est pour 3 mois. Et hier, on a appris qu'Air Canada va en bénéficier. Or, c'est définitivement une industrie qui ne sera pas retournée à la normale d'ici 3 mois. Je me demandais si vous commencez à réfléchir à des façons de distribuer l'argent d'une autre manière qu'à tout le monde qui le demande, étant donné que toutes les industries ne sont pas exactement dans la même situation.
Comme le Premier ministre a dit et comme Dr. Tam a dit, on comprend que la situation sera difficile pour plus qu'un mois, plus que 2 mois. Et nous devons être prêts. Aussi, comme Dr. Tam a dit, on ne sait pas exactement quand la situation va finir et quand ce sera possible pour les Canadiens et Canadiennes de retourner au travail. Ce que le gouvernement a déjà fait et ce que le gouvernement continuera de faire est être là pour les Canadiens, pour les travailleurs et pour les entreprises. Nous comprenons que cet choc économique n'est pas causé par l'économie, par les processus économiques lui-même. C'est un choc externe. Et pour cette raison, c'est le devoir pour le gouvernement d'appuyer les Canadiens, les Canadiennes, les travailleurs et les entreprises pour si long que est nécessaire. La bonne nouvelle est que notre gouvernement, notre économie, au début de la crise, était dans une très, très bonne forme. Et le Canada, le fédéral, a les ressources fiscales pour faire tout ce qui sera nécessaire pour protéger les Canadiens pendant cette crise. Concernant la durée, personne ne peut pas dire aujourd'hui pour combien de temps ce sera nécessaire d'appuyer l'économie. La seule chose que nous pouvons dire, c'est que nous sommes prêts de faire tout ce qui est nécessaire. On a mis en place des mesures nécessaires aujourd'hui et on l'a fait d'une manière très, très vite. Comme Jean-Yves a juste dit, le CERP est là aujourd'hui et le CERP aide les Canadiens. Nous voulons le faire dans la manière si vite avec la subvention salariale. Concernant l'avenir, on pense de ça et la seule chose que je peux dire, mais c'est une chose importante, c'est qu'on sera prêt d'appuyer, de soutenir l'économie canadienne. Merci.
Alors, en suivi, si je peux vous demander, la logique d'appuyer pendant du long terme une industrie aérienne qui, manifestement, ne se relèvera pas de ça dans les 3 prochains mois, est-ce que l'argent ne pourrait pas être mieux utilisé ailleurs?
Je pense que c'est important pour nous tous de comprendre que personne ne peut pas faire des prognoses certaines concernant l'avenir. La Dr. Tam était très, très claire ce matin en expliquant les prognoses qu'on a concernant le progrès du coronavirus. À cause de ça, à cause de la grande incertitude, ce que nous devons faire, c'est exactement ce qu'on a fait. Et c'est de donner l'appui qui est nécessaire aujourd'hui à l'économie. Et je veux assurer les Canadiens qu'on continuera d'appuyer l'économie pour tout le temps qui sera nécessaire. C'est très important pour nous de ne pas laisser le coronavirus de blesser notre économie. Nous faisons les choses nécessaires maintenant pour protéger la santé et les vies des Canadiens. Mais nous savons très bien que ces choses qu'on fait, ces choses nécessaires, ont un impact économique sérieux. Le travail, le devoir pour le gouvernement, c'est de protéger l'économie pendant cette période et c'est ce qu'on fait maintenant et on va continuer de le faire. Nous devons protéger la capacité économique du Canada et nous devons protéger les vies des Canadiens et Canadiennes et c'est ce qu'on va continuer de faire. Et je veux finir en disant que le Canada, le fédéral, a les ressources économiques qui sont nécessaires pour faire ça.
Merci, Madame la Vice-Première ministre. Prochaine question au téléphone.
Thank you. Merci. Our next question, notre prochaine question, is from Mia Rabson with the Canadian Press. Please go ahead. À vous la parole.
Hi, this is a question probably for Dr. Tam. Given the modeling that you released this morning and sort of maybe the better understanding of how you see COVID-19 unfolding in Canada, are you recommending that government enact stricter measures for things like physical distancing in businesses? And if so, what additional measures do you think should be considered?
Yes, so we do have to sort of monitor the trajectory very closely on a daily basis. I think together with the other chief medical officers, we recognize that we need to try and ascertain how do we measure the effectiveness of our public health measures. Some of these studies might be quite innovative. For example, just tracking mobility of the population, and some of these kind of data people have seen sort of being published as we speak. And that tells us a little bit more about how well Canadians are doing with some of these recommendations and where we can strengthen those recommendations. I think we know that some areas of social distancing has really been reduced in terms of no one is gathering, really. We're trying to strengthen. There's certainly no mass gathering of any size. We're just trying to strengthen the message to Canadians that really you should avoid all non-essential travel and stay at home as much as possible during this critical period. I think that behavioral scientists are studying these kind of phenomena as well, and how do you nudge people to sort of do better from that perspective. We know that contact tracing is very key to make sure that we stay on the trajectory and if necessarily improve. I think yesterday I talked about the fact that you can, on the one hand, really try and support people in self-isolation and in quarantine, making sure they have the right environment to do so safely. And if they don't have the conditions at home to do that, to support them, maybe housing in a different space. I think, but on the other hand, you've seen jurisdictions come with more measures on the compliance and enforcement side to try and ensure that all Canadians know how serious this situation is and that we want them to take things seriously. So tightening up on making sure people who are sick stay at home and that any close contacts also self-isolate is really, really important. So I can't stress that enough. And as I've said, we do continually have to improve on laboratory testing capacity. That helps you detect the cases, which is absolutely important to maintain this trajectory and put this epidemic to a first wave to a close. So it's not any really different to what we've been recommending all along. But we would, at some point, I think as we are coming down the other side of the epidemic curve, we would like to look at different ways at which we can measure the impact and success, both positive and also negative impacts of our measures as well, so that we can recalibrate as we sort of move ahead. But for sure, case detection, contact tracing, and social distancing still remain key.
Thank you, Doctor. Mia, follow-up?
Yeah, I'm just wondering, there's a lot of Canadians, I think, watching the United States and some of the scenarios going on there with a bit of alarm. And I'm wondering, how dependent is our best case scenario modeling on border measures and how the United States does, since it does seem like their situation is more dire?
Well, we say that even within Canada, we have significant regional differences. So we are different from what's happening in the United States in terms of their epidemiology. And we want to be able to stay in that epidemic control curve that I presented today. So we'll be doing everything that we can. I think the measures that we've put in place, and the ministers may want to comment on that too, is really restricting travel to essential travel, ensuring that those essential services continue, but really cutting down on the amount of travel between the two countries to those essential travel will remain very key. And again, we can't adjust any of that until we've seen not just what happens within the Canadian context, but definitely what's happening on the other side of the border.
And I'll just add, Mia, that today was our weekly call with my counterparts at the G7. The health ministers meet every week to talk about the scenario in our various countries and what's been working and the struggles that we are having collectively as countries. And one thing that was acknowledged, I think, by all partners was that there needs to be a global effort to eliminate COVID-19, that this can't be, Canada's problem will not be resolved until all countries have strong measures, both on the suppression of COVID-19, but also on the long-term treatment and prevention of COVID-19 in all of our populations. And that was recognized by all health ministers in that call.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. Notre prochaine question, our next question is from Hélène Buzetti avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour. J'aimerais revenir sur les scénarios qui nous ont été présentés ce matin. Ce n'est toujours pas clair dans ma tête quel est, selon vous, le scénario le plus probable. Vos graphiques semblaient miser sur un taux d'infection de 2,5 à 5 pour un nombre de morts allant de 11 000 à 22 000. Mais il y a aussi le taux de 10 produisant 44 000 morts que M. Trudeau a utilisé ce matin. Alors, je comprends que vous n'avez pas de boule de cristal, mais à l'heure actuelle, quelle est la prédiction, selon vous, la plus probable?
Merci pour la question, c'est Dr. Njoo. Comme on a dit ce matin, maintenant, on continue, tout le monde, tous les Canadiens et Canadiennes aussi, tous les ordres de gouvernement et de systèmes de soins de santé aussi, santé publique intégrée, pour continuer avec un scénario pour vraiment aplatir la courbe. On dit maîtrise de l'épidémie. Ça veut dire que on prévoit continuer peut-être avoir au futur une pourcentage 1% d'infection dans toute la population. Mais c'est sûr que 1% de toute la population canadienne, c'est pas dans un mois, c'est peut-être dans plusieurs mois, peut-être même une année ou plus. Donc, si on fait les calculs, avec une population de 37 millions, on prévoit peut-être avoir une totale de cas peut-être 376 000. Mais ce n'est pas la seule chose à faire. Il faut aussi voir qu'avec une prévision peut-être pour 1%, on est vraiment au début de notre courbe épidémique. Et même à l'échelle nationale, c'est vraiment seulement la somme des épidémies de toutes les régions à travers le pays, dans toutes les provinces et territoires. Donc, c'est difficile à prévoir exactement quand on va arriver au pic. Pour le moment, actuellement, on est vraiment au début et on ne peut pas voir quand on est arrivé au pic, quand on n'est pas arrivé sur la pente descendante. Donc, pour l'instant, c'est vraiment la priorité de tout le monde de continuer avec nos meilleurs efforts de distanciation physique et on verra d'une semaine à l'autre qu'est-ce qui se passe. going back, sorry. In terms of where we're at, certainly from all of the best efforts, all Canadians, including all levels of government and also obviously the public health and healthcare system, we're looking at what we call hopefully best case scenario, 1% sort of attack rate in the whole Canadian population. If you do the simple arithmetic, looking at the Canadian population of about 37 plus million, obviously that would translate to about 376,000 cases. But those 376,000 cases, we certainly don't expect it to happen overnight. We expect it to happen over many months, even a year or so. Look at where we're at today. We're about to, 20,000 cases now. So we still have a ways to go. Having said that, it's also difficult to predict exactly when we'll get to our peak, because you won't know when you're at the peak till you're actually on the other side of the sort of downward curve. So it remains to be seen what happens over the coming weeks and months. But for the moment, in terms of what we're doing, I think we can't let go of our public health measures. Everyone is doing their best in terms of physical distancing. And I think we just have to watch week by week how we're doing as a country.
And as a follow-up, maybe I can ask Dr. Tam, it's not clear to me, so should I understand from what's being said that the 1% scenario is the one we are working on right now if everything remains the same? I understand we can't predict the future, but right now you're saying that the most probable scenario is the 1% one?
I wouldn't say the most probable, because we don't know that yet. I would say that's the aspirational and our ambitious goal that we, provided in terms of the briefing today. And everything that we can do now will reduce that infectious rate and in as short a time as possible. So we called it our ambition because we will have to check to see exactly how much of the population is infected. Some of that kind of work, as we work through this first wave, would include, right now we're looking at what kind of serologic tests are available, for instance, that will help us determine how much of the population in the end of that first wave have actually been infected. So these are some of the data that still needs to be gathered.
Thank you, Doctor. We'll now turn to the room. Start with Mary Kay Walsh from the Globe and Mail.
Hi there. Still on the modeling, we spoke with one academic who said that your models appear overly optimistic, that, for example, your best case scenario curve does not show the subsequent curves, and that it therefore it might even be faulty, because if we do have everybody on lockdown, unless they leave lockdown with a vaccine, there will be more spikes.
So this is a novel virus for which the population is not immune. So it's true that if after the first wave, and we did really, really well, only a small proportion of the population is in fact have encountered this virus as immune, we are in for a significant period of time where we would expect that public health measures to some extent will still be applied. It'll be, to me, a sort of new normal. We have to be really careful how to release some of those public health measures because the population is not immune. So we've seen a little diagram where there are little blips after the first big wave. I think these are scenario planning. What we want to do is to make sure that any subsequent wave is dealt with really rapidly and it stays below the capacity of the health system to be able to cope. So that's the concept of those scenarios. But those little waves could continue to occur for a number of months until either, say, a vaccine is discovered or then the majority of the population is immune in some way. But we can't go too far into the distant future in estimations because the virus could change. We don't even know if you are immune today, how long that immunity will last for. So by all means, we're not saying these scenarios exactly what's going to happen. This is an estimate, and these can be adjusted. But whoever that person is entirely correct. We have a long ways to go in the whole trajectory of this pandemic.
Okay, thank you. And Minister Hajdu, on my colleagues' reporting this morning on sort of the 2006 pandemic report and what it foretold and what we're now experiencing, I'm wondering if you regret that Canada was not better prepared, that Canada did not have what appear to be sufficient stockpiles, for example, in the emergency stockpile, and that things like widespread testing were not put into place early enough.
Well, I'll answer generally, and then I'll actually turn to Dr. Tam. But first of all, I want to thank the excellent leadership of our public health officials who have been guiding us through this since the emergence of this brand new virus at the end of December, early January. Obviously, Dr. Tam used the pandemic plan as a guidance document to stand up the organizations that led to, for example, the public health officials from all across the province and territories meeting on a regular basis very early on. In terms of the national stockpile, of course, always more could be done to prepare in terms of pandemics. I will also remind you that provinces and territories have stockpiles. And of course, the work that we're doing collaboratively right now on ensuring that frontline healthcare workers have what they need is critically important. I will also say that in terms of anticipating the behavior of the virus, I think Dr. Tam has repeated this a number of times, and I think it bears repeating. This is a brand new virus. So even if we had testing capacity, so to speak, what kind of test? What did that look like? Those were all things that had to be essentially developed once we were able to receive the genetic sequence from China in those early days. And so I just want to, again, reiterate my thanks for the leadership of the phenomenal public health officials that have guided us through this. Certainly, we're grateful for their expertise and their involvement in determining our response. Did you want to speak a bit about the early testing and the challenges around that?
So I think Canada is a country that have done pandemic planning for longer than almost any other country in the world, and we have a strong history of doing that. That particular plan, 2006, came out just after SARS. We actually experienced another pandemic even after that, 2009. That led to essentially an evergreen plan, which you will be able to find on our website. And the lessons learned from 2009 is to be able to flexibly and scalably mount a response. You can't tell what the next pandemic might be like. So it's the flexibility in the system and taking a risk management approach. Instead of those specific phases that we had in 2006, we moved on to a much more flexible response. And based on my experience, as I've always said, when you've seen one pandemic, you've seen one pandemic. You cannot anticipate what that next. In fact, the best thing to do is throw out all the previous assumptions because they're likely to be wrong. We do have much better tools than before. Those genetic sequencing done in breakneck time, quite frankly, has allowed Canada to develop our PCR test really, really fast. I'm actually quite happy with the fact that there's a network of public health labs. We decentralize. Unlike some countries, we decentralize the test pretty fast. Quality assured, the provincial labs all picking up their ability to do so, and then now distributing the laboratory capacity down the line as well. And we are pursuing other tests. So I would essentially put it to all Canadians that we were one of the fastest countries in the world to establish good laboratory capacity. Could we do more? Sure. I'd just like to explain the NES, the National Emergency Stockpile, Strategic Stockpile, just a little bit. As we all know, the healthcare system is in the jurisdiction of provinces and territories, and they do have supply management. They use a lot of resources on a daily basis. At the federal level, we are much more strategic in what we have in that stockpile, and that's deliberate. We moved from the sort of Cold War model of what the National Emergency Stockpile looked like at the time to one that's highly specialized. In it is the country's only stockpile of certain specific countermeasures, like the smallpox vaccine, like the Ebola countermeasures, which no one else actually has. That's the role of the federal stockpile. We have some other smaller surge capacities, but it was never designed to back up the whole health system in Canada. What we do, though, is together with other government departments, put together the coordination mechanisms needed to pull together that infrastructure. We had a massive role in pandemic vaccine infrastructure building and putting it one of the world's first pandemic influenza vaccine contracts in the world. And we are striving to be as early as possible in a global leader in vaccine development and also ensuring that we look ahead to that day when we do have vaccine candidates, that we're in the best position for that. So that's some of the roles that we're doing. And you've seen multiple whole of government response looking to get any supply that we can. We're in a global global supply shortage situation for almost everything that we need. So I can certainly attest to the fact that everybody is pulling out all stops. And that is part of our role, is not to just stockpile stuff in a lot of places, but pull together the mechanisms so that there's access.
Thank you, Dr. McKenzie.
Hi, Mackenzie Gray from CTV. Dr. Tam, I've got a question for you and Ms. Freeland as well as a part of this. On March 21st, we closed the border effectively for the entire world. We stopped the U.S. Citizens from coming in that day. Dr. Tam, when the models that we've seen today, how much did closing the border impact our ability to plank the curve, as you like to say? And Ms. Freeland, on this same issue, the Prime Minister has said essentially that we won't see normalcy in our lives until there is a vaccine. So can we conclude from that that the border will not be reopened until we have a vaccine?
So I well recall that particular week in March where almost everything happened, not just some of the border measures that the federal government played a key role in, and some of the travel advisories, but also everything else, like reducing mass gatherings. Much has been done by the province and territories within about that same time frame, which is why we're saying that these coming weeks are critical, because we systematically escalated all of those measures around that time period. So teasing out the exact contribution of every single one of those components may not be the easiest. What I will say is the whole world global traffic also went down at the same time. And we do know that if we looked at our cases, the contribution of travelers as being cases diminished over time.
So the Prime Minister did indeed explain, as Dr. Tam has done, that we need a vaccine to really be through this. In terms of what that reality means about the border, we just can't say today. And it would be foolhardy in the extreme to make long-term predictions about what border measures will be. Having said that, as you know, we have taken really meaningful measures at the border, including the land border with the United States. We have introduced mandatory quarantine for everyone coming into Canada wherever they begin their journey. And we have been introducing increasingly effective ways of enforcing that quarantine. All of those measures are really necessary, and they are helping us to protect the health and safety of Canadians.
And if I just might add, I think this is a question that all countries are facing right now as they try to contain their own community transmission and their cases go down. The question becomes, how will they manage then the importation of questions? And I would echo Minister Freeland and Dr. Tam that is unknown as of yet. But I will tell you that we are studying those countries that are ahead of us on the curve, that are on the downward slope, if you will, and looking how they contain those bumps of transmission very carefully so that we can learn from their experiences. And certainly, if there's any silver lining, it's that we are earlier on our journey in terms of the rise in the curve, that we're able to look at the experiences of other countries that have experienced that peak more recently than us.
Dr. Tam, everyone is in agreement, and we've brought this up a number of times in questions to you, that testing is a core component of being able to figure this out. We've spoken to a number of people who have spoken to their doctor, and they've said, okay, you should get tested for COVID, you're showing symptoms. They go to the testing facility and they say, we're not going to test you. At this point in time, are you considering making any changes to the restrictions in place for people when it comes to testing in Canada? And the modeling today has shown, and both Dr. Njoo and you have spoken about this, that there will be multiple waves. How are we going to get these multiple waves under control if we don't expand the testing criteria that we have to include everyone who shows symptoms?
So we are improving our laboratory capacity, and I think that is ongoing at multiple fronts. And I think I've explained it in the last days, where we're trying to improve on the volume and the capacity for the PCR testing. There's a need to get the reagents and other components of that. And we're trying, again, it's like any supply, every way possible, including domestic, domestic concoctions, if you like, of the said reagents and all of that, so that we can improve capacity. And we are testing a significant number of people and have maintained a good rate of testing compared to many countries in the world. But we will continue to do that and look at point-of-care testing as well as the serologic testing in the future. What I will say is that when we provide guidance in terms of where the priority focus might be, and the people who absolutely have to be tested, including healthcare workers, the vulnerable population, etc. At the moment, our public health measures are such that mildly sick people we're advising to stay at home. And some of them are not being tested because we are focusing on priority groups. As the laboratory capacity changes and different kind of tests come on board, and we're in a different trajectory in the epidemic, then we have to increase testing as we come down the pandemic and trying to detect the next incursion. That's when we would have to test more widely again. So it is a very dynamic process, but we still expect our recommendations, and this is a behavior change for Canadians. If you're sick, stay home. The key is the public health action on breaking change of transmission, whether you've had the test or not. I do think that there is a role for, of course, serology to determine the basic immunity level in a population. There's a role potentially to look at how immunity works, particularly in groups that are vulnerable or groups that are delivering essential services. So those are some of the priorities going forwards. And so I think, we will evaluate that as we go along, but absolutely upping our lab testing capability is what all provinces and territories and us are trying to do right now.
Thank you, Dr. Mora. Politico.
Yes, thank you, Maura Forrest, Politico. This is, I think, for anyone who wants to answer it, but Canadians got a lot of pretty bleak information today, both in terms of job numbers and in terms of the projections of infections and fatalities. And aside from the information, there's still a lot of uncertainty, a lot of questions that haven't been answered about when we might be on the other side of this. They're now heading into a holiday weekend where they're being asked to stay away from their families. And I just wonder how you think Canadians should react to this. How should they absorb this information and deal with it?
Well, first of all, I would just say that I understand that there's a lot of fear and there's a lot of distress and there's a lot of anxiety. And, I would say that all of us are feeling that with Canadians. I think this is a time where the uncertainty itself is, difficult to manage. Just the questions that we are receiving from all of you, essentially, when will this be over, I think is the pressing question that most Canadians have. When will this be over? As I've said, that this is a time for us to pull together as Canadians. And I know that that fear is real, but it will take the courage of all of us to maintain the practices that public health has prescribed us, if you will, to end this situation earlier, to protect the health and the lives of our loved ones and our friends. And there are ways, personally, I think, that we can feel better. And for me, one of the ways that I feel better is when I do things for other people. Many people have reached out to me, by the way, and I thank all Canadians who have sent messages of encouragement and of positivity. But we can all do that in our lives to the people that are lonely and that are isolated. We can all send notes. We can all call those people that we know are struggling, or maybe even those that we're not thinking are struggling, to say that we're thinking of them. There are multiple ways to connect with people that aren't physical, and people are craving connection right now. They are craving connection with friends and with family, and I would say that it's important that we all reach out to the people in our lives. We can also help those people that are left behind. There are a whole bunch of people that are left behind. There are people that have no one, and have no one to get groceries for them, and have no one to actually check in on them. And it's, I think, the most Canadian thing that we could do is to remember all those people in our lives, and even those people that are not directly in our lives, that have been left behind in all of this, that are even more fragile and even more vulnerable. It might be the little old lady next door to you that has a really hard time getting around, that doesn't have anyone in their life. It might be that child on the road that looks at you beseechingly as you're walking your dog. People are saying hi way more than they ever did, and it's a genuine hi. It's a genuine hello. We can donate to charities if we have a little bit left over. We can see if our food bank needs a volunteer or two to help distribute food. And I think through the act of giving, through the act of reaching out, actually it makes us all feel better. And I realize this is not the simplest answer, but it certainly is one that I think for me has helped a lot. That when I step out of my own anxiety and my own worries and my own direct kind of world, and I reach out to other people, it makes me feel better too. And so I think together, this is what we mean when we say together, Canadians will get through this.
And I just want to add one thing, Mara. You suggested that the data released today would make people feel frightened. And I think that's right. But what I would also like to say is information is power, and facts are powerful. And what we have had over the past 10 days or so is a tremendous sharing of information by governments across Canada, starting with the provinces that have been doing a terrific job of sharing really detailed data with the people in their provinces, and then with Dr. Tam and Dr. Njoo sharing a sort of federal roll-up. And I would really encourage Canadians to feel informed and empowered by that data, because what that data says to me is we need to do what we are doing, and that while the physical distancing actions that we are all taking in our daily lives are hard, for sure they're hard, and it is hard to practice physical distancing, and it's really hard to lose your job because of it. Terrible. Having said that, to me, what the numbers show, what the data shows, is we're on the right track, and it is in our power, as Dr. Tam just said, to achieve that ambitious, aspirational target. We can all do it. We are all a part of it. So turn that very understandable, legitimate fear into power and a conviction that we all need to do this hard thing to get the best possible outcome for Canadians.
Thank you. And a follow-up from Minister Hajdu. There's been some debate about the possibility of virtual sittings of Parliament, and how important it is for Parliament to still convene in person. I wonder, do you believe that it's safe for Parliament to still sit in person with a reduced number of MPs?
I know the House Leader and the various folks that have their mind turned to this would only suggest convening in person with appropriate measures in place to protect the health and safety of all parliamentarians. As you can see, I'm in Ottawa every day. I want to thank all the cleaners who prepare this room for us every single day, and in between. There are measures that we can take in terms of sitting distantly from one another that would be applied. And certainly, if that decision is taken that we need to meet in person, I will count on all of the professionals in our lives who are working so hard to keep us safe as we have to physically attend our work sites.
Thank you, Minister. Operator will now turn to the phone for 2 more questions. 2 dernières questions avant de mettre fin à la conférence.
Thank you. Merci. Our next question, notre prochaine question, is from Michel Lamarche avec TVA Nouvelles. Please go ahead. Your line is now open.
Bonjour, c'est une question pour le docteur Njoo. J'aimerais vous questionner sur les pourcentages présentés ce matin de taux d'infection dans la population. Depuis le début des points de presse, vous nous parlez de 5% de personnes infectées dans ceux qui sont testés au pays. Est-ce que ça laisse pas entendre que les scénarios du 1% de la population infectée ou 2,5% des personnes infectées, ce sont les scénarios les plus réalistes?
Merci pour la question. On a dit plusieurs fois que les résultats des tests de laboratoire, c'est toujours une sous-estimée de la réalité, parce que c'est pas tout le monde qui tombe malade, qui s'est exposé, est atteint avec l'infection, qui est allé avoir un dépistage, un test. Donc, le pourcentage, c'est un peu élevé, on dit 5%, mais on sait qu'il y a beaucoup de personnes peut-être atteintes avec l'infection. On ne sait même pas maintenant actuellement. Comme on dit aussi, au futur, on pense aussi d'avoir des autres tests de laboratoire, comme on dit, sérologiques, pour avoir une meilleure estimée de la proportion de la population qui peut être infectée qui a aussi à monter une réponse immunologique pour avoir des anticorps. Ça c'est la base d'un test sérologique. Donc, je pense qu'on est vraiment au début de la coupe épidémique pour le pays. Et si on continue tout le monde avec nos meilleurs efforts, je pense qu'on a une bonne chance d'avoir, comme on dit, le meilleur scénario de 1% taux d'infection de toute la population. Mais c'est trop tôt pour prévoir exactement qu'est-ce qui va se passer. Et c'est aussi un autre enjeu. Et je sais que tous les provinces et territoires continuent maintenant avec les meilleurs efforts d'augmenter la capacité laboratoire aussi pour dépister, tester tout le monde au fur et à mesure qui ont besoin. Aussi, actuellement, on sait que les tests, c'est basé sur quelque chose, le séquençage génétique. Et je sais que tous les provinces et territoires augmentent la capacité pour commencer cette sorte de technologie. Mais on est aussi en train d'augmenter notre outils avec les autres dépistages, tests, comme on dit, plus les points au service et aussi les dépistages sérologiques à voir. Enfin, on va voir, j'espère, une plus grande suite des outils pour dépister toute la population. Mais c'est quelque chose qu'il faut suivre de jour à jour, d'une semaine à l'autre.
J'ai une autre question pour vous, Dr. Njoo. J'aimerais vous entendre sur les centres de soins de longue durée, les CHSLD, les résidences privées également pour personnes âgées. On le dit depuis le début, là, les hôpitaux sont capables de gérer pour le moment au pays. Par contre, on se rend compte que dans les centres de soins de longue durée, dans les résidences privées pour personnes âgées, là, ça gère pas du tout. On le voit dans bien des provinces. Est-ce qu'il y a des mesures? Et là, je vous demande une réponse précise et concrète, s'il vous plaît. Est-ce qu'il y a des mesures que vous pouvez aider les provinces à mettre en œuvre tout de suite pour que dans les CHSLD, ça fonctionne mieux à partir de maintenant?
Merci pour la question. On sait que oui, c'est vraiment un environnement. Les populations les plus vulnérables sont les personnes âgées dans comme vous avez dit, les établissements de soins de longue durée. C'est plus difficile des fois dans un établissement comme ça d'utiliser les mesures nécessaires parce que c'est peut-être possible que dans un établissement on n'a pas beaucoup de chambres privées. On accepte aussi que c'est toujours à l'échelle locale, aussi provinciale et territoriale, c'est c'est les autorités qui gèrent comment ça fonctionne dans les établissements avec le personnel, aussi les mesures dans les établissements de soins de longue durée. Ce qu'on fait maintenant actuellement, c'est Dr. Tam et moi et les autres aussi, tous les médecins hygiénistes en chef, on discute un enjeu actuel, c'est peut-être des lignes directrices, les orientations pour les établissements de soins de longue durée. Et ça peut aider aussi le personnel et les établissements au futur pour mieux gérer la situation. Mais c'est quelque chose, c'est un enjeu actuel et on sait que c'est une priorité pour tout le monde.
Thank you, Doctor. Opérateur, une dernière question, s'il vous plaît.
Thank you. Merci. Notre dernière question, our last question, is from Micheline Laflamme avec Radio-Canada. Please go ahead. À vous la parole.
Merci beaucoup. Bonjour tout le monde. Alors, ce matin, vous avez fait connaître vos données, vos modèles. Vous avez parlé du nombre cumulatif de décès et vous avez aussi indiqué le nombre de personnes aux soins intensifs, mais il n'y a aucune donnée sur le nombre de malades qui vont avoir besoin d'un respirateur. Alors, vous avez sûrement une idée du nombre de respirateurs qu'il y a à travers le pays en ce moment. Alors, à partir de quel pourcentage de la population infectée notre système de santé devient débordé?
C'est moi, Dr. Njoo, encore. Merci pour la question. C'est difficile à estimer, mais on pense que peut-être que si on prend le pire scénario, que tout le monde qui a besoin des soins intensifs est peut-être une candidate pour avoir un respirateur artificiel. Donc, on a fait des calculs et on sait plus ou moins avec les estimés des provinces et territoires, c'est quoi, comme dire, le nombre des respirateurs artificiels à travers le pays. Mais comme on a dit plusieurs fois, c'est pas seulement une question de nombre de personnes qui ont peut-être besoin d'un respirateur artificiel, mais c'est aussi le temps. J'utilise toujours l'exemple que peut-être dans une population sensible, on peut toujours avoir 1000 personnes qui peut-être si les 1000 personnes tombent malades avec l'infection, ils auront besoin d'un soin intensif et même un respirateur artificiel. Mais si nous réussissons comme toute une population et aplatir la courbe, les 1000 personnes dans cette population qui auront besoin d'un peut-être soin intensif ou un respirateur artificiel, c'est vraiment une différence pour ne pas déborder le système de soins de santé si les 1000 personnes tombent malades dans la même semaine ou pendant plusieurs mois pour avoir un système de soins de santé qui est capable d'accommoder tous les patients.
Micheline, on suivi?
Oui, d'accord, merci. Et puis pour mieux contrôler la propagation du virus, l'Alberta et la Colombie-Britannique ont annoncé cette semaine des stratégies pour s'assurer que ceux qui entrent dans leur province respectent l'ordre d'isolement puis diminuent les risques d'infection. Alors, si pour mieux contrôler justement la propagation du virus et puis peut-être les vagues qui vont suivre, est-ce que la géolocalisation, par exemple, ou la proposition de la Colombie-Britannique d'avoir un scénario d'isolement, est-ce que ce sont des mesures, Mme Freeland, qui pourraient être encouragées à travers le pays ou que vous pourriez adopter?
Nous avons travaillé en étroite collaboration avec la Colombie-Britannique concernant les mesures additionnelles qui étaient annoncées hier et nous sommes en train de travailler avec toutes les autres provinces et territoires pour mettre en place les mesures comme ça. Chaque province a ses caractéristiques particulières, mais nous appuyons fortement ce que la Colombie-Britannique a fait en étroite collaboration avec nous et nous sommes absolument prêts et pas seulement prêts, nous sommes aujourd'hui et hier et avant-hier très engagés en travaillant avec toutes les provinces et territoires sur cet enjeu.
Thank you, Deputy Prime Minister. That's all the time we have today. Ceci met fin à la conférence de presse. Merci.